I'm Dr. Jonathan Chung, and today we're going to be doing a concussion research breakdown talking about this study that was published in JAMA, and it was published last week, talking about outcomes in patients with mild traumatic brain injury without acute intracranial traumatic injury. The paper investigated how long it takes the average person to recover from a concussion because the literature in this space varies quite a bit. Most of the sports-related concussion literature suggests that the overwhelming majority of patients who suffer a concussion should be asymptomatic within about 10 to 14 days, and only a small minority of patients are going to develop persistent post-concussion symptoms. But this doesn't necessarily reflect what a lot of people in the concussion rehabilitation space experience in their practice. The paper looked at patients that went to the hospital with a traumatic head injury, and these are patients that didn't have any serious findings on a CT scan, and their Glasgow Coma score was 15, which is normal. And they wanted to see, with these patients that had a mild traumatic brain injury, what were their outcomes at 2 weeks and at 6 months. The most startling finding in this paper is that at the 6-month mark, 56% of patients had an incomplete recovery. So this paper is interesting because the prevailing view is that the overwhelming majority of patients will recover their normal function within 2 to 4 weeks, while this paper suggests that at the 6-month mark, 56% of these patients actually report that they are not back at their previous levels of functionality. Now, there are some caveats to this. So some social factors that predicted a lack of recovery is whether or not you had a college degree. If you didn't have a college degree, you are more likely to be in the incomplete recovery group. And also, if you had Medicaid or were uninsured, then you were also more likely to be in the incomplete recovery group. Some possible biological factors include whether or not you had a previous history of psychiatric illness, whether that's anxiety or depression or ADHD. And also, if you had a female sex, then you were also more likely to be in the incomplete recovery group. So what are my takeaways? The biggest thing I take away from this is that your sports-related concussion is probably a completely different patient population than your general concussion patient. People that get sports-related concussion are already fitter and healthier than the general population, which is going to help improve recovery and outcomes right from the get-go. Sports-related concussion patients also have a lot better access to health resources, whether it's athletic trainers, physical therapists, neurologists, that can all participate in the rehabilitation process, whereas your general population is likely to go to the ER, get discharged, and not get any follow-up after that. That is to say, we need more evidence-based concussion providers to see the non-athletic part of the population.